in Uganda, we have now integrated NCDs into primary health care. Before we did that, we did a study to see whether we integrated management of hypertension and diabetes into HIV care would work. Because our HIV colleagues were concerned about the successes they have already achieved. And they thought integrating NCD care would compromise their successes, would bring stigma, and things would not work. So we first did a study, which is actually published in peer-reviewed journals. We decided to open up HIV clinics for NCD care. So it didn't matter whether you have diabetes, hypertension, or HIV, it was the same clinic. And we thought people without HIV would fear, because of stigma, to be associated with HIV. But we found actually stigma was with us, the health workers. Because what the patients want is the quality health care. A case in point was TASO. TASO stands for the AIDS Support Organization. It has a big clinic in Kampala. And the people who go there are normally HIV. But when we said people with diabetes and hypertension, irrespective of whether you're HIV or not, you can go and get services. They were overwhelmed. People are interested in services, not where they get the services. So we learned that, and we decided now, with stop orders and reducing financing for healthcare, we have decided that we integrate chronic care. Whether everybody with a chronic condition will just go into that stop clinic and will get services. And the lesson is that patients will go there so long as the service is there and they don't have the stigma. So that is what we want to learn, and that's what we want to share. And the successes in HIV were not compromised at all. Still high patient turn-up. They were not lost to follow-up. Adherence was good, and the viral suppression remained very high. So what I advise our colleagues is that don't fear to integrate, thinking that the successes in other programs will be compromised by integration. We still do have challenges that I call upon the partners to partner with us, especially that people who are used to managing HIV, they are now finding it difficult to manage hypertension and diabetes. But we've tried to create simple protocols for them to follow, and they are trying, and they are doing it. But we need more of that training. So we need to sensitize the healthcare workers. We need to improve the supply chain system, because there are also some weaknesses there, but also to orient health workers on how to manage NCDs. But otherwise, it's working, and it's work in progress. Thank you.